In this video, I help you to diagnose your knee pain using its location and description. We cover the cause of these knee issues and the solution for the most common ones. If your pain is at the front of your knee, under or around the kneecap, especially with running, cycling or using stairs, but it isn't swollen, it's likely that you have runner's knee or Patello-Femoral Pain Syndrome. 80% of people with runner's knee feel it while squatting, so that's a good way to test it. It's caused by the kneecap not running properly along its groove and grinding against the bones underneath. Two things can fix it. The quickest and easiest fix is to loosen the outer thigh muscles that pull the kneecap too far out. To do that, sit on a low chair with a straight leg and relaxed thigh muscles, turn your leg in a bit, and then rub firmly on the lower half of these outer thigh muscles for 30 to 60 seconds daily with the heel of your hand focusing on any tender areas. I'll leave a link below to a more in-depth video on how to do this. The other fix is to correct internal leg rotation, which causes a huge amount of different knee issues, which I'll cover at the end of this video. If your pain is just below the kneecap, in the tendon that joins your kneecap to your shin bone, especially with exercise or fully bending or fully straightening the knee, then you're likely dealing with Patellar Tendinopathy. You can test for this tendinopathy by relaxing your thigh and getting a friend to press one hand just above the kneecap and the other thumb just where the tendon attaches to the bottom of the kneecap. Tenderness here indicates Patellar Tendinopathy. Now, if your pain is just above the kneecap, in the tendons of the thigh muscle, then that's usually Quadriceps Tendinopathy. Both Patellar Tendinopathy and Quadriceps Tendinopathy tend to come from a sudden increase in exercise using the thigh muscles, like running or cycling. Both tendons are really just a continuation of the quad muscle on each side of your kneecap, so the treatment is the same for both. To fix these tendinopathies, you firstly need to reduce your exercise load and keep any exercise within a 2 to 3 out of 10 pain scale. Then begin doing exercises to strengthen the tendons with things like wall sits, squats where you lower down and then assist yourself back up again, or slow split squats, depending on your tolerance. I'll leave a link to a video on how to strengthen those tendons. Just be aware though that pain around the patellar tendon can sometimes be inflammation of the fat pad underneath the tendon. This is often tender when you fully extend your leg or press on each side of your patellar tendon when you bend your knee. It can get inflamed from a fall onto the area just underneath your kneecap or from the internal leg rotation issue that you'll see at the end of this video. An MRI can help to confirm it. If your knee is noticeably swollen or even a little red at the front, you probably have a swollen bursa at the front of your knee. The most common of these is pre-patellar bursitis, which usually occurs when you kneel on a hard surface a lot but without using knee pads. If it isn't too swollen, often just icing or stopping any kneeling will be enough to sort it out. But if it's red or really swollen, see your doctor just in case it's become infected. If you have a painful, swollen, hard lump below your knee, just where the patellar tendon attaches to the shin bone, then you have Osgood-Schlatter disease, which is not really a disease, but actually the inflammation of a growth plate where the tendon attaches. This occurs primarily in older children and adolescents as they're growing, when their growth plate is still active, but can trouble some people right into their 20s and beyond. Icing the area and reducing the amount of vigorous activity in growing kids with this issue is the easiest way to settle down this inflammation. Now, if the pain is on the inside of your knee, it can be a few things. Sometimes it's just a strain of the inner knee ligaments from an injury where your knee was pushed too far in. Rest and ice is all that's required for that. If you've damaged your inner meniscus though, you might notice that your knee catches, gives way occasionally, or it's hard to fully straighten or fully bend. If you bend your knee to 90 degrees, press into the dip each side of your knee just below your kneecap and draw a line straight back from there. That's your joint line where the meniscus is. If your pain is there, or if it's painful to firm pressure on that joint line, which is a good test for meniscus injury, there's a good chance that's your problem. MRI can help to confirm the diagnosis. If any meniscus damage is in the outer third of the meniscus, which has a good blood supply, a smaller meniscus tear can heal within 4 to 6 weeks. Range of motion exercises like gentle heel slides in both directions and strengthening exercises like straight leg raises within comfort can help to facilitate the healing. If a flap of the damaged meniscus is large, sticks out inside the knee, or doesn't flatten out by itself, sometimes a surgical trimming of the meniscus is necessary. Arthritis can cause pain almost anywhere in the knee, but it's more common in the inner knee. It tends to be a diffuse pain, is often swollen, and gets stiff after rest. Changes in weather can affect the pain, and often you'll hear a grinding or a grating sound. You can't heal arthritis, but the same knee slides and straight leg raises that you do for meniscus injuries can help to keep good strength and range of motion in the knees. If your pain is a couple of centimetres below the joint line and a bit forward, you may have inflamed the pes anserine bursa. It'll tend to be sore during exercise, can get puffy, and is more common in overweight people and women. 3 muscles that attach to the top of the shin bone can irritate and inflame the bursa here, which is much more likely if they're stretched due to internal rotation of the leg, which we'll cover shortly. Icing the area can help to settle it down. Outer knee pain can be meniscus or arthritic pain too, with similar symptoms to the inner knee versions. But often pain here is due to rubbing of a tight iliotibial band on the bones of the outer knee. This gets worse with exercise, can click or go a bit red, and even extend up into the outer thigh. MRI or just a simple ultrasound can help to confirm the diagnosis. Easing up on exercises like running and cycling can help, and icing the area, but the outer thigh rub that we did for runner's knee can do wonders here, because it relaxes the tight muscles that are rubbing on the outer part of the knee. Orthotics to correct bow legs, or putting a heel lift under the other leg if it's more than 1 centimetre shorter than the leg with pain, can both reduce the rubbing. If your pain is below the joint on the outside, on the little bony lump where the outer fibular bone attaches to the shin bone, your pain is coming from the second smaller joint of the knee. It can get inflamed or restricted due to things like kneeling or sitting with your legs crossed. Bending your knee to 90 degrees, holding that bony head of the fibula with your fingers and pushing forwards and backwards for 30 seconds once or twice a day can mobilize the joint. Start gently to test it though, and if that feels sore to do, just ice it instead. Lastly, pain behind the knee often comes from a strained popliteal muscle, especially if you feel it near the fold at the back of the knee or even slightly to the outside when walking downhill or running. Here you want to rest or reduce any downhill running or skiing, especially on uneven surfaces, and make sure that you have good supportive footwear, particularly if your feet tend to overpronate. Now, if you feel a ball-like swelling at the back of your knee, that'll be a Baker's cyst. These cysts tend to form when swelling inside the knee from things like arthritis or meniscus damage gets pushed into the back of the joint capsule where it attaches to a bursa. Ultrasound can confirm and measure the cyst, but if it's particularly large and it doesn't go away by its own, an MRI can help to figure out what's causing the inflammation. Now, as I mentioned, several of these conditions have a common underlying problem. Internal leg rotation strains the inner knee structures and changes the trajectory of the kneecap. And 2 main things cause this internal leg rotation: foot pronation or flat feet, and weakness of the outer glutes. So many knee problems can be prevented or corrected by working on these two issues. For overpronation of the foot, you can wear pronation-specific footwear, wear orthotics to support the foot arch, and strengthen muscles that support the foot arch using exercises like short foot exercises and calf raises with a towel between your heels. I'll leave a link to a video with the full details. And if you strengthen the outer part of the glute medius and maximus muscles, they'll help to externally rotate the leg to bring the knee back the other way. Simply standing on one leg, moving your pelvis from side to side and bending forward slowly until light fatigue, but no more, once a day will help to strengthen these muscles, straighten up your leg and take pressure off your knee. In fact, if you strengthen the outer glutes, strengthen your quads, minimize any foot pronation, and rub your outer thigh after any leg exercise, you can prevent or improve the majority of knee issues.